Hey everyone, so this is to instruct you on how to use the EYELIGHTS. EYELIGHTS are a tool that we've been using here. They were invented by Dr. Peter Gillet. They're a great device. Been using them for many years. As you know, what we're doing is we're combining different types of sensory input to activate specific areas and specific networks on either the right hemisphere or left hemisphere. So vision is obviously very, very powerful stimulus to the brain, and light is again, very powerful stimulation. Light goes primarily to the back, the occipital lobe, what we call Brodmann area 17, 18, and 19. But it also goes to an area called the temporal parietal area, which is an area more area 39 that is processing and integrating of light and visual input. And then we have another area in the inferior temporal lobe, which is Brodmann area 20, which also integrates audio and visual. And the TPO area is really where we integrate everything together. That's the angular gyrus of Brodmann area 39 and Brodmann area 40. So when we're using these lights, what we're doing is we're stimulating specific areas of the brain, and we're trying to induce different frequencies. Ultimately, we're trying to change brainwave frequencies in different networks. And so the visual network, as well as the ventral attention network, which is very associated with the visual networks, are different from right side to left side, and they respond to different frequencies of stimulation. We know that the right brain responds more to frequencies of light in the blue, green, or purple range, and the left brain responds to light waves that are in the frequency of red, orange, yellow. So typically what we do is for right brain, we will recommend blue lenses that also have blue lights that are flashing in only the left half of both eyes. So we'll see that this flashes for 3 seconds in the left half, and it is off for 8 seconds, and that is normal. This side here, on this side, right, which is the left side if they're facing you, this purple button, if we press it and hold it, turns it off. If we press it again quickly, turns it on, okay? And so the lights, if you are using them for right brain stimulation, should be in the blue lenses in the left half of both eyes, which only goes to the right brain. And we will use them for the prescribed time. We usually start out with these for about 20 minutes, and then every 2 weeks or so, we may go up another 20 minutes if there's good toleration of the stimulus. Ultimately, we want to get up to 60 minutes 2 times a day, and we want to use this in combination with the transcranial Fisher-Wallace unit and the TENS unit, and we may do this with something like the interactive metronome. So again, we're combining different things together. That's part of the Melillo method, what we call this cross-activation or co-activation of many different modalities. Now, if this is programmed improperly, so the programming is this button on this side, which is on the right side, this purple button. Now, you can only change the program and press it when the lights are flashing. So what you see is I'm literally changing the program right now. And we're getting to back where they are going to be only on the left side. Right now they're on the right side. That's the wrong side for these color lights and lenses. So now again, if I try to press this program now, nothing happens. I'm pressing the purple button, nothing happens. But when they start to flash, I can change it. So now they're in the right, they're in one eye, but now we want to change them to the proper position. So you have to be fast. They only work when you can only change it like now, okay? You have to use that button. So then again, to turn them off, you press this button once, you hold it on the left, and it's off. Now red and red lights we use typically for the left brain. And again, these lights should be only in the right half of both eyes, right? So when they flash, you see they're in the right side and the right side. So they're in my, they're going to be in the out here and in here, right? Only the right half of both eyes, and they're going to cross over only to the right brain. There's a battery in here that you can change. They usually last for about 100 hours or so, and otherwise turning on and turning off is the same. Sometimes we may progress or use different colors. These are green lenses. Again, we use them for the right brain. We have purple lenses that may be used for the right brain. And then there are yellow and orange that can be used for the left brain as well. So there is a progression to that. We have that written in the Melillo method protocols as to how we decide that and how we use it. But you've been prescribed to use these glasses. We've given them to you. And if you're doing this virtually, then this should give you instructions on how to use these lenses. Again, you start out at 20 minutes twice a day, and you build up to where you're using them for an hour twice a day, ideally. Okay? All right. This should give you enough instructions on the use of the EYELIGHTS.